A urinary tract infection, UTI, is an infection affecting any part of the urinary system, including the kidneys, ureters, bladder, or urethra. UTIs are usually caused by bacteria, most commonly E. coli from the digestive system, that reach the urinary tract. The most common type is a bladder infection, cystitis, with symptoms like a frequent and intense urge to urinate, burning sensation when urinating, urine that appears cloudy, dark, bloody, or strange-smelling, and pelvic pain. UTIs can occur when bacteria enter through the urethra and start to multiply in the bladder. Risk factors that make this more likely include being female due to a shorter urethra, pregnancy, diabetes, problems fully emptying the bladder, catheter use, and previous UTIs. Diagnosis is based on symptoms and confirmed with a urine test detecting bacteria and white blood cells. Treatment usually requires antibiotics, taken by mouth for simple infections and intravenously for complicated cases. Severe or recurring UTIs may need further testing for an underlying cause. Lifestyle changes that keep the urinary system healthy can help prevent infections. Staying hydrated and urinating regularly to flush out bacteria are important. Diet also plays a role since certain foods may encourage good urinary tract health. The following 15 foods can promote urinary tract health and prevent or relieve UTI symptoms due to their vitamin, mineral, and antioxidant content. Number 1. Blueberries. These antioxidant-rich fruits contain compounds called glycosaminoglycans that prevent bacteria from sticking to the lining of the urinary tract. The antioxidants protect against cell damage by reducing inflammation. About 1/5 to 1 cup daily is recommended. 2. Broccoli, a cruciferous vegetable high in vitamins A, C, and E plus folic acid. Compounds called isothiocyanates are released during digestion that help eliminate potential toxins and carcinogens. Broccoli has anti-inflammatory abilities beneficial for urinary tract health. Enjoy about 1 cup steamed or raw a few times a week. 3. Cranberries. Popular for UTI prevention due to substances called proanthocyanidins that keep bacteria from adhering to cell walls in the bladder and urinary tract. Preventing bacterial overgrowth inhibits infection. Cranberry juice or an extract powder can provide relief. Drink about 8 ounces of juice or take 500 milligrams capsules each day. Number 4. Dandelion greens. These greens act as a gentle diuretic to increase urine output, flushing out extra fluids and bacteria before an infection can happen. Dandelion is also high in vitamin A, vitamin C, iron, and calcium for continued immune support. Add raw greens to salads or sauté about 1/2 cup a few times a week. 5. Ginger. Contains compounds called gingerols and shogols that contribute to its anti-inflammatory properties, preventing UTI-causing bacteria from multiplying in the urinary tract. Make ginger tea from fresh grated root or drink ginger ale to soothe symptoms. Use about 1 tablespoon grated ginger daily. 6. Garlic. Contains antioxidant and antimicrobial sulfur compounds like allicin. These help fight UTI bacteria and infections. Allicin may also prevent future UTIs by blocking receptors that allow bacteria to attach to cells lining the urinary tract. Use fresh chopped or minced garlic in cooking, eating 2 to 3 cloves each day. 7. Kefir. A fermented milk beverage that populates the urinary tract with good bacteria to crowd out any UTI-causing bacteria trying to get a foothold and cause infection. These probiotics help restore balance in the urinary system. Choose a plain, unsweetened kefir and have about 1 to 2 cups daily. Number 8. Pineapple. Its enzyme bromelain reduces inflammation in the urinary tract and has antimicrobial effects against common UTI bacteria. It also interferes with the adhesion of certain bacteria to bladder cells. Eat fresh pineapple or drink 2 to 4 ounces juice each day. 9. Spinach. Provides anti-inflammatory compounds like camphorol that protect tissue linings. It's also packed with immunity-boosting vitamin C, antioxidant beta-carotene, vitamin E, and zinc. These nutrients defend against bacterial infection and support faster healing. Add a few cups of raw spinach to your salads and smoothies each week. Number 10. Yogurt contains good bacteria called probiotics that keep the urinary tract populated with healthy microorganisms. The presence of these lactobacillus bacteria make it difficult for bad bacteria to infect the urinary tract. Choose plain yogurts with active cultures and have a 6 ounces serving 2 to 3 times per week. 11. Tomatoes contain lycopene, a powerful antioxidant that helps reduce inflammation in the urinary tract. Lycopene interferes with bacteria's ability to cling to bladder and kidney cells as well. Aim for 1 to 2 cups of cherry or grape tomatoes a few times a week. 12. Bananas. Their high potassium content helps alkalize urine, discouraging bacterial growth which prefers acidic environments. The antimicrobial properties in bananas also help fight infection. Eat 1 ripe banana daily. 13. Green tea. Compounds called catechins have antibacterial and anti-inflammatory activity that supports urinary tract health. The antioxidants in green tea protect bladder cells from damage while flushing out toxins. Drink 3 cups of unsweetened green tea per day. 14. Sweet potatoes. Vitamin A precursor beta-carotene helps maintain protective bladder cell linings to resist infection. Other nutrients in sweet potatoes exhibit antibacterial effects against E. coli and other UTI-causing bacteria. Work 1 large baked sweet potato into your diet a few times a week. Number 15. Celery. Contains apigenin and luteolin, antioxidant compounds that reduce inflammation and fight infection. Celery also acts as a gentle diuretic to increase urination and keep bacteria from adhering to cell walls. Juice celery with other vegetables or eat 1 to 2 celery stalks daily. As outlined above, certain foods and drinks contain beneficial vitamins, antioxidants, and compounds that make the urinary tract environment less hospitable to bad bacteria that can invade and infect the bladder and kidneys. Some of them provide anti-inflammatory effects that ease UTI symptoms like painful urination. Others contribute antimicrobial properties that fight against infection-causing bacteria. Certain foods help flush out bacteria before they have a chance to adhere to the urinary tract lining. A diet focused on ingesting more of these UTI fighting and prevention foods is a helpful complement to antibiotics or other treatments prescribed for existing infections. Getting ahead of urinary symptoms by maintaining a healthy urinary tract environment can help some individuals avoid contracting another infection. Supporting immune defenses and reducing excessive inflammation in the system also aid the body in staying infection-free. Along with incorporating more of these dietary additions, proper fluid intake is hugely beneficial for keeping UTIs at bay and treating any active infections. Drinking adequate water and fluids prevents bacteria buildup by regularly flushing the kidneys and bladder. Urinating more frequently reduces likelihood that bacteria will colonize and cause infection. Those feeling UTI symptoms should void whenever there is an urge to urinate rather than holding it. For recurrent UTIs, additional prevention methods like urinating before and after sexual activity, wiping front to back, avoiding potential irritants like douches or strong soaps, wearing breathable cotton underwear and taking showers over baths may also be suggested. Prompt antibiotic treatment of any infections and identifying any complicating risk factors are key as well, but supportive dietary measures can make a big difference. In closing, urinary tract infections involve bacterial invasion and inflammation resulting in uncomfortable symptoms. While antibiotics remain the first-line medical treatment, certain foods provide therapeutic plant compounds that can help resolve and prevent recurrent infections. Their action helps make conditions in the urinary system less welcoming for infection-causing bacteria. Blueberries, broccoli, cranberries, dandelion greens, ginger, garlic, kefir, pineapple, spinach, and yogurt have research behind them showing UTI fighting abilities. They demonstrate antibacterial, anti-inflammatory, and protective effects for tissues being compromised by infection. Other integrative therapies may also be supportive alongside antibiotics, like drinking adequate fluids, urinating frequently, proper bathroom hygiene, and identifying any risk factors. A UTI prevention diet should emphasize the foods and nutrients discussed here. Getting them from your regular meals and snacks provides continuous support. You can also opt to take cranberry capsules or drink unsweetened cranberry juice daily. Isolating bromelain supplements from pineapple stems or taking a probiotic supplement can further boost your urinary defenses. Vitamin C is extremely useful as well, since most of the foods listed contain high amounts. Pay attention if your symptoms are not resolving or keep recurring. This may signal an underlying issue like diabetes or a kidney problem enabling repeated infections. Seeking further medical insight can help determine appropriate solutions in complex situations resistant to standard UTI treatments. Supportive care through nutrition and lifestyle adjustments often makes a big difference regardless. An ounce of prevention truly applies to keeping urinary tract infections away. I hope focusing your diet on these beneficial foods helps prevent the misery of UTI symptoms. Please let me know if you need any clarification or have additional questions as you put this guidance into practice. Here's to freedom from painful and frequent urges to urinate. Thanks for watching, and we'll see you in the next video.